Hi everyone, this is Shalli Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. Welcome back to my YouTube channel. I'm back with another NMC OSCE video for you. But before that, if you like my video, please press the like button and subscribe to my channel. Share it with your friends and other nurses who are preparing for OSCE exam. Today's video then. And keep those comments coming. They are really helpful in knowing what you want to know from me next, and also I try to answer all your questions as much as time I get. And obviously if you like the way we teach, please give us a go. And if we do offer online training for NMC OSCE and also face-to-face training, so do get in contact with us on oscenustraining@outlook.com. If you email us, we can give you more information. Okay, let's get started with today's video then. So today's video is really important one, because I know it's a real struggle for planning station for overseas nurses, and the way the template is and how we write care plans back home. We normally write in just patient notes, the notes for what care we given, but in UK we very much do a care planning per nursing need. So it can be quite difficult to understand how to plan care for your planning station. And the most common fail in this station is not choosing the relevant nursing needs. So this keeps coming up again and again in test center, that nurses are failing for choosing not the correct nursing needs for their care plan. That's the biggest reason for failing planning station. So today I'm going to try to get that right for you, okay, to try to explain it to you that how you avoid making that really big mistake, because that is the most common fail in planning station, because that is the start of your care plan, is your nursing need. If you've not started the right way, you're not going to be able to pass that station. So we're going to nip that problem in the bud today and think about how to choose, how you can be safe in choice of nursing needs when you plan care plan and when you do the planning station. That's what we're going to look at today. And when you come to my training, this is something I really go through with you in a lot of detail, and make sure that you understand that you're not going to make that mistake in your exam. Of course, we always giving you tip on every station, but this is the station we really spend a lot of time, because we know other stations are very hands-on and this is the writing, but this is not to underestimate that, because it does take a lot of effort to get your brain into that way that you can write these care plans correctly. And the first thing for that is choosing the correct nursing needs for your scenario. And let's get started. So I'm going to try to explain it to you, what will help you to make the right choice. Okay, so the first one, when you are given the care planning sheet, and of course don't forget that you're given your paperwork back from the assessment station, your form is back with you, the document you used for patient history, they give you that back. Okay, so to keep that in mind, we'll come back to that one in a minute, but let's just go through the first slide. Think back to the assessment station. What problems patient had and what you discussed, keeping in mind presenting symptoms. Remember, so you already done the assessment station. Planning is nothing new to you, because you have already met the patient. You have talked about their nursing need in the holistic assessment part of the assessment station. So you already should be having a clear idea in your head what you discussed with your patient. Now it's very easily said than done, because I know you are quite nervous in your exam. You have done the assessment station, in between you may have done implementation, and now you're at planning and you kind of like muddled up in your head because everything went so quick like a whiz, and you were worried about making mistakes, not making mistakes, and you were just like, oh, I'm not sure. But do think back, okay? That would help. Just take a deep breath and think back. And you can ask to take a few deep breaths even before your timer start for planning. So read your template, what they have given you, and before your timer start, just ask the examiner to give you a few seconds, just take some few deep breaths, okay? And that's your thinking time to think, okay, so what did I discuss with my patient? What was my patient come in with? And So you already gathering your thoughts before you start the timer, before the timer starts. Okay, think back to your assessment station, what problems you discussed. Okay, and it will come back to you. If you stay calm, take few deep breaths, it will come back to you. Okay. Number 2, now you might have thinking, you might have thought, oh yes, I did discuss that. Did I discuss that? Yes, I did discuss that. But double, as soon as your timer start, you got all your paperwork back from assessment station, which is your patient history form. As you can see, patient recent history is given to you when you do the assessment station. So you can see the document on the, so it's given back to you, you can see on the screen, and that one clearly says, you know, what is your patient presenting complaint. So as long as you choose from the presenting complaint, you will be pretty safe. Okay, so like this one, it says the patient is coming with shortness of breath due to pneumonia. Of course, I'm going to write one of the care plans on breathing difficulty, which is shortness of breath my patient is experiencing. So that's very obvious one. Presenting complaint can be very, very helpful in writing the first nursing need. Always choose that if you possibly can. So if you discussed it, choose that one that, you know, of course, you're going to talk about, because that's the most important need for the patient at the moment, because they presented with that one. So shortness of breath. And then there are other secondary needs, of course, how shortness of breath is affecting other things. It's affecting their eating and drinking because they have not been eating well. And as you can see, I marked another one is the mobilizing. So your document does help you actually if you use it wisely, and if you remember to check it before you just want to burst in and start writing your care plan. Just give it 10-20 seconds, look at it to make sure whatever is in your mind, you already know what you're going to write. Okay, you probably have a very good idea in your brain what 2 care plans you're going to write for this patient, but double check it with your admission form. That is definitely matches your admission form and you're thinking on the right track here. You're not choosing something which just popped in your mind in last second. No, just make sure you check your patient history form for that. So that's another way you can stay safe in your choice for the nursing need. So third one is think, is an important significant nursing problem for my patient. What does that mean? Because sometimes your brain just in a bit anxiety and your first or second station may not have gone to plan as you would have liked, but you definitely want to pass this one. So okay, so gather, calm down and do not exaggerate. Does that mean is, like, you know, sometimes you just overthink. Like I recently had we were doing practice and I asked them to write care plan for a diabetic patient, and one of the care plan they wrote was patient is at risk of developing constipation. Now, that's just exaggerating to the present condition, to what you haven't discussed constipation with them in an assessment station. It doesn't say anywhere in the form, but you just overthinking. Yes, diabetic patient with their slow processes and digestion and everything, it might affect and they might get constipation. It might. But that doesn't mean it's true for your patient, because whatever nursing need you choose, it has to be present nursing need for your patient. It has to be factual nursing need, not what can happen in future. Well, some things are okay if there is an obvious thing, immediate complication, like for a post-op patient, they're going to develop, they may be at risk of developing wound infection. Of course, that's fine, but not like exaggerating that diabetes is definitely going to be causing constipation for this patient. So especially if it's not said anywhere in the document and you haven't discussed it, why are you writing it? So that's what I'm trying to say. Don't jump to the conclusion, don't exaggerate, do not overthink. Again, same thing. So do not overthink and just think, just see what's happening with your patient at present. That's what you need to think about. Okay, keep it simple. Don't make your nursing head go really 10 times forward. Okay, just stay in present and keep it simple. Next thing is, need to a present problem and effect. Okay, so if your patient is not in pain when you assess them, not in any significant amount of pain, mild pain, well, okay, that's just simple pain, but pain is not their significant problem. There are other problems you should be dealing with and talking about, but pain is not their like a diabetic patient, if they're not in any pain, why would you write a pain care plan? And then because you are thinking diabetes can cause diabetic neuropathy, diabetic neuropathy can cause pain. I've seen everything written on care plans, so nothing surprises me. But then again, you're overthinking, making it over complex. I'm not saying it's not true that diabetic can't have diabetic neuropathy and pain. Yes, they can, but that's not the case at present with your thingy, and that's not what you're thinking about. Think about the immediate needs, okay? What is at present the most significant needs for your patient. So don't just make it complex. And has anything changed? That's the other thing to think about, because when you get a surgical scenario, when you meet the patient in assessment, they're pre-op. But when most of the time when you are given the care planning template tells you clearly that your patient is back from theater. So, and then if you're still writing pre-op problems like patient has experiencing anxiety due to upcoming surgery, or patient is in pain before surgery, or whatever you're writing, or patient has a nursing need, say preparation for surgery. But that does not relate to your patient anymore, because your patient already had the surgery. Okay, so you're not paying attention what they're telling you now. So you really need to think, has anything changed since the assessment station? It means really every other scenario is fine. It's just the surgical scenarios where your patient is back from theater now and they would like you to do post-op care plan, because that would be the most relevant now. What happened pre-surgery is not that relevant anymore, because they'd already been to theater. If they were anxious because of surgery, they're already back. If they needed preparation for surgery, well, that's already happened. So why are you writing those nursing needs? So you need to write post-op care plans if your patient is already back. If they're not back from theater, still waiting for surgery, absolutely go ahead and write the pre-op one. But if they're back from theater, you need to write post-op care needs, okay, post-op nursing needs. So that's a very, very common fail in surgical scenarios. So be careful about that, okay? Think very clearly. Now we're going to the next screen here. Try to relate nursing needs to patient presenting complaints or diagnosis, okay? Obviously post-op patient is exception that you're going to write on post-op care plan, but I'm talking about other scenarios where you have to choose two relevant nursing needs. So when I say, they have the patient history form, there is a presenting complaint section. I already told you pay attention to it, because that would give you a lot of help to choose correct nursing needs. And also think in that way, what is my patient diagnosis and what I have discussed, but what can be the presenting complaints and diagnosis, and what kind of nursing needs I can choose. So I'm giving you a few examples here. I'm going to talk about it, and you might hear me saying different scenarios and what nursing needs can you choose. So listen carefully. So like your shortness of breath scenario, whether it's pneumonia, asthma, or your chronic heart failure, if they're presenting with shortness of breath, of course you're going to write a care plan on shortness of breath. Eating and drinking ones, like again, it's a activity of daily living, but how does it connect to your nursing need? It would be like risk of malnutrition. Same, if your patient got shortness of breath, is that affecting their eating and drinking? But it has to be factual. Don't just make it up. If your patient is eating, drinking fine, and it's not mentioned anywhere in your form, and you did not discuss it with your patient and doesn't seem to be a problem, patient hasn't brought it up with you in assessment station, you shouldn't write. But if it is a real problem, like it was for this scenario when we looked at it, then yeah, of course, risk of malnutrition you can write, of risk of dehydration if they are not eating and drinking well. Mobilizing, so have they got reduced mobility? So mobilizing is the activity of daily living, but what the nursing need here is the patient is experiencing reduced mobility. Maybe shortness of breath is stopping them from mobilizing well. It may be swollen ankles if they got chronic heart failure. It could be age related. It could be anything, like, or maybe they are in too much pain and their mobility is restricted. So that could be a reason, okay? So think about that. Okay, so next one is washing and dressing. So that could be one of the things you can think about. And again, you would not you will say the patient is experiencing difficulty in washing and dressing. It could be your Alzheimer's scenario where your patient is very forgetful and confused, and they're finding it very difficult to wash and dress themselves, because obviously they got advanced age as well, and also forgetfulness and confusion will make it very difficult for them to do this activity of daily living, which is very simple, washing and dressing, but it might be very difficult for your Alzheimer patient. So that you could do it, you could use that. So next one is sleep. Now, a lot of you write sleeping care plans and you want to write it for pretty much all scenario, but that's not true. Okay, this has to be a factual problem for your patient, like, and you would have discussed it. Say your diabetic patient is getting up few times a night and they're having disturbed sleep because of frequency of urination. Fair enough, you can write it if you discussed it with your patient, or it was mentioned somewhere in your patient history form. Okay, so that could be, but think about it. It could be that pain is stopping them from sleeping, but you should have discussed it already. Okay, pain, again, there is a lot of scenarios in exam where you can write about pain, but again it has to be realistic to your scenario. Just don't make a pain care plan just because you have practiced it really well and you know how to write pain care plan. Pain has to be a significant problem for your patient at that time. Say somebody's come with pneumonia or asthma, but they haven't got any real chest pain, maybe little bit, very, very mild, but nothing significant. Then you shouldn't be writing a pain care plan, because that would not be the significant nursing need for your patient. Okay, so just make sure if you're writing pain care plan, then that is a significant problem for your patient, the pain. So pain care plans, like, you could write on headache for subdural hematoma because they have come in with headache, so that would be fine. End of life patient, are they in chronic pain? That would be fine as well if you have checked. Fall and fracture scenario, if your patient got hip fracture, are they in pain? If they're not, of course they will be in some kind of pain with fall and fracture, so you can talk about that. And post-operative, of course, every post-operative patient is going to experience some degree of pain, and that would be a significant problem for them. Okay, so that is a good one to think about for a post-op care plan. Even though you haven't met the patient post-op, you don't know what their pain score is, but you don't have to have pain score to write a pain care plan. You could just simply say patient is experiencing pain at the surgical site. So moving on to the next one, could be confusion and memory loss. So you go Alzheimer's scenario where you have completed the cognitive impairment test for the patient, so it would be very appropriate to write that care plan. That patient is experiencing increased confusion and memory loss due to Alzheimer's. In fact, I've done that for you on the YouTube, so you can go ahead and check. And of course, confusion can be a significant problem for a patient, your neuro patient, the subdural hematoma. If you found them to be confused when you did the Glasgow Coma Scale, then of course you can write a confusion care plan for that patient. Risk of fall, again, think about it. Does your patient have history of recent fall? Then you should definitely discuss that with your patient in assessment station and can choose that as a care plan. Even if you did not get time to discuss this with your patient in assessment station, but you see in the admission form that definitely your patient has a recent history of fall, then of course you're still safe to write that care plan. If you just run out of assessment station time, you discussed other problem and didn't discuss that one, but it's a factual problem, for as long as it's a fact and it is a real significant problem for your patient and it says in the paperwork in admission form, then yes, of course you'll be fine to do that. So think about previous history of fall or confusion scenarios where your patient is confused, whether it's Alzheimer or subdural hematoma. Think, because confusion can increase the risk of fall, but have they got recent history of fall as well? Just think about that and you can write that. And then depression again. So if you have been asked in the community scenarios to complete depression tool, which is your PHQ-9, then of course you will be safe to write a depression care plan, which is again covered on my YouTube channel, so you can see that. Next one is risk of developing pressure ulcers. your fall and fracture scenario, which is bed bound, no activity, so again they would be at high risk. Again, is a quite elderly patient, they fell and had hip fracture or neck of the femur, so they could be at high risk of developing pressure ulcer. So you could write a care plan on that. Again, there is one completed in my YouTube channel when you see it, if you want to see it. Next one is risk of developing wound infection. Again, so you can think about like, you know, so risk of developing infection, so wound infection. So for a post-op patient, you could write on risk of developing wound infection, because that is a true significant problem for every patient who goes through surgery. There is always a risk they could develop surgical site infection. And for your diabetic scenario, maybe look at your paperwork. Does it say patient has history of recurrent UTIs, or patient is worried that they might develop UTI? So, you know, again, because that's a significant problem for a diabetic patient, especially if your scenario is talking about already your admission work, the patient has history of recurrent UTIs, then that would be a good one to write here as well. So I'm just giving you some examples. Of course, we can't go through everything for every scenario, but yes, I'm giving you some good examples how to choose your nursing needs wisely related to your diagnosis and presenting symptoms. But check and double check with your paperwork, okay? And also think what you discussed in the assessment station. But if it's a post-op patient, if they tell you the patient is back from theater, please do not write the pre-op problems. So I hope this video is going to help you to make the right choices for the nursing needs for your care plan, which is one of the biggest, most common and the biggest reason for fail in planning station. So I hope you like the video. If you do, please press like and subscribe now. You can visit us on OSCEnurstraining.com, email us on OSCEnurstraining@outlook.com. I will soon be back with another video for you, so don't forget to like and subscribe. Bye for now.